The trend in Alzheimer's research is to get people into trials as early as possible, before there's been any real damage to the brain due to the process of Alzheimer's disease.
Dr. Michael Plopper, the principal investigator of the Sharp Neurocognitive Research Center, wants to get people into trials so early they haven't developed any symptoms of the disease yet.
What we know about Alzheimer's is that we tend to accumulate amyloid decades before we develop actual symptoms.
Amyloid is the toxic protein that accumulates around the cells in the brain, and it leads to the degeneration of those cells, memory loss, and eventually the failure of all important mental functions.
And the point is either to prevent it from starting or to ameliorate it once it does start.
The AHEAD study, overseen by Dr. Plopper, is taking people between the ages of 55 and 85 who are positive for amyloid but show no cognitive problems. Those in the trial may get the latest drug thought to slow down the disease process or a placebo.
For the first time, there's an agent that actually slows the process of Alzheimer's, and that's lecanemab or Leqembi. And there was a 27% reduced decline in cognition over 18 months for people who took lecanemab.
Lecanemab, or Leqembi, is FDA approved for people with mild dementia due to Alzheimer's, but not always covered by insurance. Dr. Plopper feels it's worth taking for some individuals, despite possible serious side effects, which his team keeps a close eye on.
They're potent medications. What they do is remove amyloid from the brain. They attach to it, and then brain cells, the immune cells, actually break down the amyloid and it's removed. So it creates a space in the brain. And there can be an effusion of fluid and sometimes blood. And so there can be microhemorrhages appear. So that's what we look for.
In the meantime, there is something all of us can do to help prevent mental decline.
It's a reasonable diet, predominantly Mediterranean, so they have been proven to help with prevention of cognitive decline.
Plopper adds reasonable exercise, good social connections, stimulating mental activities, limiting alcohol, and avoiding smoking for a brain-healthy lifestyle. Kimberly Hunt, ABC 10 News.